If I were to give some advice to people who don't do this for a living, but are dedicated and compassionate and want to provide the best possible care to their patients, I think a couple of things come to mind. One is trying to understand not just what the surface expression of something is, but what the motivation is, especially on a parent side. So, a parent who is taking us a little bit by surprise. So instead of being sort of more kind of receiving and deferential, but is a little more assertive, and this is what I need for my kid, especially if they have the stature that Jairus has physically. Don't just look at the surface. Look at what's driving this person. What's in their heart? Why are they saying what they're saying? Maybe they're frustrated because they don't feel understood. Maybe they are adamant because they made a promise to their kid that they need to make sure that they keep. So looking at where their heart is as opposed to what the sort of surface expression is something I think that's important. Another is to be honest and real with ourselves, and not shy away from pain.
Yeah.
Like, I think that's a very natural human thing. Like, we shy away from pain. Like, your hand gets close to a flame, you pull it back. It hurts. We don't want that. That experience that I had the first time I met Faith, where she ended up talking on a very deep level about some incredibly personal experiences, was the most palpably painful conversation I can remember having with a patient. And so what we did is we didn't run away. We didn't change the topic. We sat with that and honored it. And then we also tried to take care of each other. Like my first step after leaving that room was to get our team, especially our two learners, into a room privately and say, are you guys okay? Because like, I've been at this long enough that I think I have a few resources to cope. And I was like, I looked at them, they were shell shocked. They were ready for something, but they weren't ready for that. And so we need to make sure that we create that space to honor that. Because if we had walked out of that room and said, okay, let's put some orders in the chart and go see the next patient, like, I think sometimes people in my business, we sweep so many things under the rugs are practically levitating. There's so much that's gotten swept under them. And we gotta stop that, or else we're not going to be able to really be present for people.
Thinking about it from a different point of view of what I would ask of providers, everything Bob said is so spot on, but I think from the classroom to the practices, I think if we could get providers to do a better job, and we're generalizing here, but a better job of balancing a couple things here. And you taught, your question to Bob was around, are you really providing good care, or good medicine if you're not doing those things? Well, to me, there's medical practice and then there's care. And what we say medical care, but we do medical practice. We need providers to really emphasize and amplify the care part of it, right? It's both. We can provide just clinical services, and that's what you're going to get is this less caring, less connected service. You're getting your oil changed, right? It's not that. We need to remember the human in this and the family dynamic. So it's medical care. And then it's the other thing I would ask is to not only listen, but hear. People, they'll sit there and they listen to the patient, they listen to the parents, but they're not hearing because they're so busy formulating their opinion, but they're not actually hearing, to your point earlier when you were sharing of what's the driver behind a sense of urgency, or why is somebody so scared, or why are they so frustrated. Dig beyond the immediate interaction to understand what is really being said. And then the last thing I would ask in terms of balance is balance the clinical with the compassion. If we could get providers to really start looking at, yeah, here's the medical thing that I know we should do through through textbooks, through training, and through practical application. Here's the clinical approach we need to take. Now, let me pause for a minute and actually demonstrate some compassion to hear, why is this upsetting this person so much? Why are they pushing so hard on this? Why are they withdrawn, right? And that's the compassion side. And we in this business, I think you are failing in your job if you're not doing both.